right? Whereas the type 2 has both the components. Insulin is not able to work properly. The second component is not getting produced enough, right? But the first component not working properly is causing overall stress and ultimately pushing the pancreas into a state of failure also.
Today at Food Farmacy, we have Dr. Akash with us. He's an endocrinologist and super specialist in hormone-related diseases. He practices at Shushrut Hospital in Paldi. Welcome to Food Farmacy, and we are going to talk about hormone-related diseases.
Sure, it's a pleasure to be here today, and I think we both are trying to do the same thing in a way, trying to spread some awareness, trying to be helpful to the community, to the people, patients, be it patients or just normal healthy people. We are trying to reach out to them and provide them some useful information.
Yes. Right? So to start with, I want to understand what are the hormone-related diseases.
Right.
From diabetes to PCOD. So please give us a brief of that.
Right, sure. So I'll give you a brief about what hormones are, like a very basic thing. What I've noticed is there is very low level of awareness regarding this kind of diseases in people. So hormones are basically certain chemicals inside our bodies, which are kind of messengers. They circulate throughout the body. They give some message to a part or organ of the body for maintaining some sort of function. So basically, they help with all the normal routine metabolic procedures, physiology, that is normal way of body to maintain itself and to grow itself. That's what they do in simple terms. Now, there are more than 100 different hormones in the body, and with each hormonal imbalance, there can be some or other disorder, some or other difficulty your body may face. And common conditions which we have heard are, one of those is diabetes, which is fluctuation in sugar levels. Another common is thyroid disorder. Others include PCOD, growth disorders in kids, that is, babies not growing in height as per their age. Also, we may consider disorders with puberty, where kids not hitting puberty as per the age, maybe earlier or later than that. Then age-related certain changes, menopausal disorders, also bone fragility, bone weakness, osteoporosis. So all this are included in hormonal disorders.
Okay. So what is a thyroid disorder?
Thyroid is a gland which is situated in the neck and produces a thyroid hormone. So whenever there is an imbalance, if it is producing more or producing less than the requirement, your body may face certain symptoms. And that is what thyroid disorder is.
What is the age group which is affected the most due to this?
So as such, any age can be affected, but usually what we see is middle-aged, 20s to 40s is the age group where more commonly we see people with thyroid alterations.
Right. And why is the reason there is this such imbalance created, and this disease was not so prominent before 10 years. Suddenly in the last decade we have seen like diabetes is there in every household. Similarly, thyroid is there in every household, just not to women but also to men.
Yes.
So what is the reason this imbalance is there?
There can be multiple reasons. Just like many other conditions, it is a multifactorial disease where multiple things are affecting the gland and causing the disease. In men or women, life stresses are playing an important role these days. Be it work related, family related, any sort of mental stress or physical stress can lead to further development of the disease. Also, food related issues, iodine consumption or consumption of certain goitrogens, this can lead to increased number of cases which
but our salt is iodized in any which ways.
But then we actually do not know how to use the salt, right? What we usually do is put the salt while we are cooking, while the food is being prepared on the stove. When we do it, when we use it this way, what happens is it gets evaporated. So majority of the iodine content is lost. Scientifically speaking, what we must do or how we should do is, once our food is prepared and when we are about to consume it on the table, we are supposed to add the salt.
The table salt is considered the worst thing for people who have blood pressure or who have any heart issues.
So the amount matters. Like we know in Sanskrit, ati sarvatra varjate. Anything in excess should be avoided. So salt in excess should be avoided. around 5 to 6 grams of salt a day is appropriate. It
Okay.
is healthy intake. Right?
Okay.
So whenever we are using the salt, rather than using the salt while cooking the food, if we use it, the table salt, if we use it while consuming the food, then it is going to provide us better iodine.
Right. So we have talked about the problem of thyroid and the age group which
Right.
gets affected.
Right.
But what is the cure for it? The cure is just not having that one medicine of 25 mg, 50 mg or 160 mg every morning. The thyroxine is not helping, right? So
Right.
what do we do for that?
Right. So it is quite a rampant question, and almost all the patients are troubled by this question.
Yeah.
I'll try to keep it simplified. This disease is a spectrum of condition. So sometimes it is very mild. There is only mild imbalance, and in some patients it is quite a huge imbalance, and the gland, the manufacturing unit, has completely gone into a shutdown state. So it is
Right.
not at all working. For this extreme patients where body is not able to produce anything, yes, pills are the only answer. Unfortunately, they have to take it. On the brighter side, these pills have got no side effects. It is quite safe to consume, and with appropriate monitoring, it's all right.
Right.
When we are talking about the patients with milder disease, there certain changes in lifestyle or food can help. Like those obese, those having higher body weight, some weight loss is going to improve their thyroid levels. Their body requirement is going to go down. Adequate iodization of the food is appropriate. Then sometimes reducing gluten containing food items is also going to help.
Yeah, there has been study which says the gluten impact on the thyroid is something which is there. It's a real thing. If you're eating more refined wheat or any form of wheat,
Right.
from breads to a local language, if we make shira and all of that affects our thyroid hormone directly or indirectly, because the capacity of the body to digest that gluten is depleted.
Right. Processed foods or gluten, very high amount of gluten, this too should be avoided or should be reduced as much as possible. And also consumption of soya bean or soya products,
Yeah.
that also should.
Anti-nutrition is more in soya comparatively.
Yes. So this kind of products, once a person reduces the consumption of this kind of products, the person
Okay.
may require lesser dose of the thyroid medicine. Some patients, if on the milder side of the disease, their gland will be able to recover, so they may not require
So recovery
pills.
is possible.
Yes, for milder disease, yes, it is.
Right.
And sometimes the nature of the disease is such that maybe there is some damage to the gland because of recent infection or something. There, if you provide adequate nutrition to your body and if you are cautious about certain food item intake, then it is likely that you may recover to a normal state.
Right. Next, we can emphasize on the hormone-related disease number 2, diabetes. The
Right.
great diabetes mellitus
Yes.
that has conquered each and every household.
True.
The pharmaceutical companies are making billions of money. Everybody is making profits from it, but the health of that person who has it is depleting every single day.
Right.
From issues like weight loss,
Right.
from issues like more and more stress, and also pills every single day. And people who are beyond pills, they take insulin, which is again, it is not easy for everybody to pass through that phase. And it's a silent killer, definitely.
True. True.
Suddenly you would wake up one day saying, oh, I have diabetes, how is it possible? Why is it affecting everybody? Type
Right.
1, type 2 has taken over the world.
True.
And India, after China, is the capital of this
Yes.
disease, and it is prevalent. And there are lots of, beyond medicine, there are conceptions saying it is curable, but we haven't seen any cure yet.
Yeah. True.
So please give us an insight.
Fine. See, diabetes is basically a disease where your body is not able to control the blood sugar level.
Yeah.
And it tends to go beyond a point where we consider a person to have diabetes. Now, for diabetes to happen, there are two things we need to understand. One is the body produces a hormone called insulin.
Yes.
Insulin helps the body to utilize the sugar. Whatever sugar is there, the insulin pushes it inside muscles and fat
Yes.
so that they can burn it or utilize it in a good way, and the blood level remains normal. Diabetes takes place whenever there is some issue in this machinery. Actually, it is very complex. But then, if a person's body is not able to produce adequate amount of insulin, which is more often in type 1, or else not utilize it or respond to insulin in a proper way, that is more often seen in type 2, then the person is going to have diabetes.
This is because there is a disorder in pancreas.
Right. So when we are talking about type 1, it is more or less pancreatic disease only. The pancreas is the manufacturing site for insulin. The pancreas has gone into failure probably because of an autoimmune condition again.
Yes.
Right. Whereas the type 2 has both the components. Insulin is not able to work properly. The second component is not getting produced enough. Right. But the first component, not working properly, is causing overall stress and ultimately pushing the pancreas into a state of failure also. Data says that almost 10 or 12 individuals out of 100 have diabetes now, or this is going to increase over a period of next 5 or 10 years. Alternative
Is
apart
it curable?
from cure.
Everybody comes to you is going to ask you the same thing. Your patient's coming to you, kya amathi cure this. Like if you have infection of any sort, it's curable with antibiotics. But this is something, it's long, it's prevalent for the longest time we can think of.
Right.
So how is saying better food, better lifestyle helping us?
So again, it is going to be a spectrum of condition. When it is in early phase, diabetes is more or less always a progressive disease.
Yeah.
So when it is in early phase, it can be reversed quite easily.
Okay.
When the person is going to exercise properly, when the person is going to be mindful about the diet and consume certain good products and avoiding certain food items, the person is likely to achieve benefits and reversal of the diabetes. But as the days pass, as the person grows old, the body goes into a state where weakness goes on increasing or where the dysfunction goes on increasing. So you cannot expect to have a reversal easily when you are living with diabetes for 15 or 20 years and you completely ignore the disease. You didn't pay much attention and try to control it.
As much time you have given to ignore the diabetes, you have to invest
more time
in order to get out of it, or at least get better, if not out from it. Okay.
True. So I'll divide it into two. One is a healthy population, those who still have not reached to the phase of diabetes. So in those kind of people, it is again important to have certain healthy lifestyles and food restrictions. Moderation is what matters. I've seen people consuming 2 to 3 teaspoonful of sugar, 2 or 3 cubes of sugar with each cup of tea. And this kind of teas they consume 3 to 4 times a day or even more, right?
Which is like 10 grams plus of sugar.
Yes. And to have a better understanding, at any point of time, your or my body is going to have somewhere around 5 liters of blood, and this whole of 5 liter blood, if you pull out all the sugar from this blood, you will hardly get 5 grams of sugar, 1 cube. And you are adding to your body each time. So per day maybe you are consuming 10 to 20 times more than this, and apart
so body will not support.
Yes, body will not be able to handle it. And apart from the simple sugar we are talking, any food we eat is going to be converted into sugar ultimately. Glucose.
Everything becomes that.
Yes. So what matters is the other foods, the complex carbohydrates or fibers, which we will
proteins.
talk. Yes, proteins. This all food items, they get into the glucose part slowly. The body handles it in a different way. Whereas the simple sugar, which we add in our diet, the body directly absorbs it and there is no process with it. It just goes inside your blood and it keeps on increasing. And then even when, for a healthy person, even when your body can handle it, it gets deposited as fat or disturbing your muscle somehow. So on a longer run, your body is going to be prone to develop diabetes. So for healthy people also, they should restrict. For diabetics, your machinery, your mechanism is already disturbed. So, what I would suggest is be mindful. Have a plan in your mind that you want to cut down all this unhealthy food items and the foods which contain unhealthy composition, right? And then you work on it. There is no simple way out of it. I'm not going to say you take this or other pill and you will forget about all the sugar containing items. It is not possible. So you have to train your brain that way. You have to learn to derive pleasure out of other activities, be it reading a good book, be it having a good vacation, be it spending good time with friends and having a good conversation, right? Rather than relying just food and sugar added items, please.
We are going to talk about hormone related issue more in depth in specific category of kids. What happens to kids when they have hormonal issues? Yes. Please give us a brief or an idea of disorder in them, and is it centric to boy or a girl? How is it?
Right. So we have seen patients or children coming into the world with problem itself.
Okay.
Right. Sometimes we get to see very young kids, 5 or 10 days old, having some problem with the sugar handling, be it going down or going up, diabetes, and even thyroid conditions as well. So it is not unusual for us to see these kind of cases, and these cases are more or less genetically determined. So there probably we cannot do anything apart from getting proper treatment, right? Other than that, when we are talking about diseases which we can modify, so be it diabetes or obesity in children or thyroid disease in children, till some extent, yes, we can have greater impact on this kind of conditions.
And we can reverse it at a very earlier stage.
Some of the conditions, yes, not all again. If at all we are talking about type 1 diabetes, it is hardly impossible to live without drugs, insulin per se.
Yeah.
Otherwise, if it is obesity related sugar imbalance, or if it is thyroid related,
weight management, it is possible.
Yes, it is possible. And the major aspect which I see these days is some of the kids have a lot of psychological or mental health related issues.
Yes.
And parents somehow not being aware of it or somehow ignoring this aspect is also an issue. I have seen a girl who was having a lot of psychological troubles, psychological trauma due to her events in early life, and then not getting a healthy environment at home. So despite being at the age of somewhere around 13, 14, she was not able to grow in terms of heights. She was not growing, and she did not achieve any pubertal growth.
Okay.
So this is a known condition that if you are not providing a healthy environment to your children, yes.
So this is a direct stress to the kid, and because of that the hormones are disturbed. And then if the hormones are disturbed, anybody could suggest that to would want the kid to go to a psychiatrist and get diagnosed. Then there are new terms like ADHD and depression and anxiety among so little kids. So this is all because, so this can be because of hormonal issues.
This can be, or these multiple conditions can also be present in a single kid.
Yeah.
So same kid might have problem with the thyroid as well as attention span or anxiety depression issue, or a same kid having a lot of depression and simultaneously gaining a lot of weight. Again, the weight or obesity causing further mental distress and further abnormal eating, what we see as coping mechanism.
Yes.
Right? So parents should be aware about these conditions, and not just one aspect. They should try to cover all the aspects with the help of appropriate specialists.
Yeah, so again, healthy eating is very important.
Yes. And the surprising aspect is, as parents, some of us are not really much aware of it, or we do not put much of thoughts in it. Kids, when they are growing, they do not have their own insight.
Yes.
They cannot make a choice between this is good for them or this is bad for them. So we are the ones, if the kid is throwing tantrums or crying for some reason, we are the ones who offer packets, chocolates and a lot of unhealthy stuff. We only promote, and then later on
that
this turns into
right away. So that has to stop and has to be changed into something better.
Yes.
Divert into a sport, or make sure that the food is home cooked, fresh. If not, at least a healthier food should be given with fruits and vegetables.
Agreed.
Less refined carbs.
Yes, exactly. So this is an important aspect where parents should work on, so that the next generation will be a lot more healthier. Otherwise, the way we are moving ahead, it is quite dark and gloomy,
Yes. All right. So now we are going to talk about first the myths of PCOD and PCOS.
Right.
What is it and why is it so prevalent among? I have seen it affecting working women so much, and also the age group of these women would be 25 plus or could start from 17 to 18 as well.
Yes. Yes.
And what should be done, and why is it affecting the fertility so much, because this is the age when women has the maximum chance of being fertile.
Right. Right. So PCOD and PCOS, for our easier understanding, one deals with the conditions where some genetic abnormality which is causing hormonal imbalance.
Right.
There is the other one which is fairly more common, maybe more than 90% of the women, where there is no tumor or no major genetic abnormality. However, their body is dealing with certain fuels or stresses in a different way, and that's causing issues. Now,
So that would increase the hormone, the testosterone and all
Yes.
in the women's body.
Yes. So, what commonly we see that this young women, when they have got obesity or overweight, they have more body fat proportion. Their fat deals with the fuels in a different way, which produces more of androgens or male-like hormones. Testosterone is the one we all of us know. There are others also.
Right.
But then their female bodies tend to produce more of male-like hormones. That leads to imbalance. Now, for a regular menstrual cycle, a female need to have complete balance at the level of brain, where certain hormones are produced, and at the level of ovaries, where other hormones are produced. So, in this women, there is some imbalance, and that is causing primary problem of irregular periods.
Right.
Apart from this, they may experience excessive hair growth or acne.
Yeah.
And once this problem begins, it is going to lead to some damage to the overall metabolic process of the body and uterus as well. So ultimately, when this women, they reach to the age of fertility, when they have their family and they are trying to conceive, that's the time they start facing major problems.
Yeah.
Their uterus, their body overall is not prepared well to have a healthy pregnancy then.
So what should be done?
What should be done is to have again healthier lifestyle. They should have their body proportion appropriately. Their weight should be optimized. They should be consuming healthy diet, less of refined diets, less of oil consumption, and regular physical activity. A woman, when she walks with PCOS and she is obese, she already has a lot of abnormalities, imbalance going on inside body. Now it takes time for our exercise, diet, and medicines to work.
Right.
And get it back into the control and get it back all smooth. So this usually takes 3 months.
Okay.
If adequate efforts are given, 3 to 4 months is the time after which the hormones get into control, and after which 3 or 4 more months, then we get to see regularization of periods and all, or hair growth
But
differs.
we have heard and we have seen the stories of patients who have been kept on birth control pills for years, for 10 years and 12 years. Like they have said that they have been kept since they were 20
Right.
or 21 until now. Then this is the age when they want to conceive a child. So they are kept on it for such a long period of time.
Yes.
In spite of maintaining the weight
Right.
and eating well, still this happens. Why?
So some of these women, as I told, they may have their genetic structure in such a way that they may require long-term hormonal therapy. But then majority of the women with adequate efforts, good exercise regimen, they tend to recover and have regular cycles, right? So that's unfortunate for some women that they have to continue tablets for a longer
certain
period.
number of women, it will take time to recover.
Yes.
Some may not
Some may not, unfortunately.
because of
yes.
genetic issues.
Yes, true. So the women you are talking who were on this pills for a very long period, probably they had some other abnormality, probably they had a tumor or something which was not diagnosed previously. That can
Right.
also be an explanation. So, women should also be cautious that if they have to take this kind of medicines for longer period, they should get evaluated properly. They should be tested properly.
So right approach to a physician, expert is also important.
Yes,
Or else misguiding can happen anytime.
true. Yes,
And the health can suffer because of that.
definitely.
Right.
And also there is increased risk of having diabetes in future in
Yes.
women with PCOD, right? So
Insulin resistance is number one.
yes, And also, it should not be like, I'm going to have my kid after 5 years. Why should I bother right now? That's the wrong concept, because
We
the
have
damage goes on.
the day you know it, you start working for
Yes.
it, or else the numbers are gonna pile up. Every day you'll have
Yes.
to work harder and harder.
True.
So as you're here at Food Farmacy, what do you think of our store and the message that we are trying to pass across about healthy eating and conscious eating?
Right. So I have been in touch with different people from different professions, and since childhood we have been seeing different kinds of advertisements, marketing for
Yes.
certain food products. But at this age, with when I try to gather a lot of knowledge, I realized majority of those food products are not the healthiest.
No.
Right. When I came in contact with you and I tried to get through certain details, and I realized that Food Farmacy is a place in Ahmedabad from where people can actually get healthy food products.
Yes.
The products which are free from refined products or refined carbohydrates, sugar-free items, less gluten containing items, less fat containing items.
Yes.
So all in all, healthier products. This is the destination, this is the place, and I'm going to be delighted to try some of your items.
Definitely. Well, looking forward, yes. So we are ending up our session with Dr. Akash. It has been great, very insightful, brilliant learning and understanding about the hormone imbalance concept and how to treat it, make feel better, and also passing the message across to the community that if you have issues with hormone imbalance, you should definitely try for an alternative lifestyle.
True.
Yes. Thank you so much.